The Affordable Care Act was passed by both houses of Congress. Yes, I know there was majority Democrat, but it was passed by both houses of Congress as legislation should. It was signed by the President of the United States. It was challenged repeatedly by the courts and sent eventually to the Supreme Court, which we as a country have deemed the place where we determine constitutionality of legislation. And the Supreme Court ruled that it was constitutional. And in spite of the fact that it has not yet been fully implemented, the vast majority of it not being implemented, it is under attack again. Even though obviously people attack and say it's a failed system, a failed program, which is difficult to say about something that actually hasn't been in place. But more importantly, the politicians are going after it again. In the House in Washington, Representative Paul Ryan has again proposed a budget quite similar to previous ones, although this one includes a repeal of the Affordable Care Act. Now, while I don't think the Affordable Care Act should be repealed, I do give credit to Representative Ryan for addressing this issue in the proper manner. Some people in the states are saying they should nullify it because they disagree. Well, they say it's unconstitutional, but the tool, the place that says that we've said should deem constitutionality has viewed it. So nullification. But the other thing is defunding, and that's why I praise Representative Ryan for doing it the right way. You can repeal legislation that you find we did the wrong thing. It was wrong. We should have done something different. Senator Ted Cruz in the Senate offered legislation to defund it. Now, to me, that is wrong. It's the law of the land. It should be funded. If you don't like it, if you think it's not constitutional, even though the Supreme Court said it was, then you repeal it. Anyway, it appears Senator Cruz's attempt to repeal it to defund it has failed in the Senate, which isn't surprising. But on a more local level, the South Carolina House, I believe it was on Monday, spent 5 hours discussing the Affordable Care Act in one particular area, the expansion of Medicaid, that the federal government will pay 100% of for the first 3 years, and then states would then be responsible to pay 10% of it, the federal government paying the 90%. And according to the Affordable Care Act, states can opt out or at any time. Democrats in the House were saying, hey, we should at least opt in for the first 3 years when it's paid for. And the House Republicans successfully blocked that. There will be no expansion of Medicaid according to the House. Now it goes to the Senate, where it may actually get some ground and be approved, but then you got to go back to the House. And we all know Governor Haley is adamantly against it. But this is not about the Affordable Care Act per se. Whether expansion of Medicaid is a good thing or bad thing is not necessarily what this discussion today is about. I want to discuss South Carolina's alternative. Republican congressmen in South Carolina have said all along, yes, there is an issue with health care in this country. We do need to address it. Governor Haley has said we reject expanding a broken system, as she spoke of Medicaid, and replacing it with a good old South Carolina plan. And we've heard that now for years. What's the plan? Well, in the discussion in the House, the plan seemed to be a couple things. Number one, the state would give money, or probably tax breaks, to doctors and hospitals to incentivize them to reduce the cost that they charge patients. Great. How much money? And is it going to be something that doctors and hospitals will do? I'd love to see the prices come down. Second, encourage patients without insurance, rather than going to the emergency room, which is extremely expensive and it raises all of our rates because those folks don't normally pay. They're urging them to go to free clinics. Now again, taking people who aren't paying their bill out of the hospital system is a good thing, because part of the problem with all of our medical costs is that we've got people go to the emergency room that never pay. So, number one, hey docs, would you lower your price? Number two, hey people, would you go to the free clinic? That's providing there's a free clinic in your area. That's providing that you can get the treatment. I find it interesting that folks who complain about socialized medicine, one of the things they say is that you have to wait forever. Go to a free clinic and tell me how long your wait is. And also, most free clinics have a financial burden area where somebody who's not uh, totally poor, but is working poor, who makes a little bit above what that minimum thing is, that poverty level thing is, they can't. The free clinics won't take them, and they can't afford insurance, which could cost $3, $4, $5, $6, $7, $800 a month, depending on how many people in your family or more. And the other crucial key to the solution from South Carolina is healthy lifestyle choices. They said that in this debate on Monday, and they've said that I've talked to two state representatives in the last about 6, 8 months, back and forth about this issue, and they make the point that a majority of our healthcare costs are the result of lifestyle choices, poor lifestyle choices, eating poorly, smoking, not exercising. I don't know if I could quantify it as the majority, but it is a very major thing. I'm a fat guy. I ate improperly. I have diabetes. Now, I assume that I wouldn't have had diabetes if I'd been eating properly. So lifestyle choices are good. And I support the idea of encouraging South Carolinians to have better health choices, to eat better, to sleep properly, to get the exercise they need. Now, that's what I've heard so far from the state as the solution to our healthcare crisis that we're in right now. One representative told me, well, insurance is only 10% of the problem. Coverage to go to the doctor is only 10% of the problem. I'm not sure where he gets that figure, but I will say this. I have two issues with this plan, especially on the healthy choices. Number one, what do we do with the people like me who made poor health choices prior to the current time and now have a disease that needs to be addressed? I need to eat better. I need to exercise more. I need to sleep more. That's fantastic. But in one of the conversations I had with a representative, he said, look, we'd be better off if people would take their meds right, exercise more, and eat better. And I said, how am I going to take my meds right if I don't have any insurance? How am I going to know that I need to take medication? And that's just on diabetes. How do we go from where we are today to this idyllic picture of the future in South Carolina where we have a state full of healthy, strong South Carolinians who don't need to go to the doctor very often? We have to get from there to here. So while I'm eating better and exercising and sleeping properly, I still need the medication to regulate my diabetes or someone's blood pressure medicine or their cholesterol medicine as they're getting better. So what's the answer there? And I don't hear anything from the state about that. But let's look beyond that. How about a woman who finds out she has breast cancer? That's not necessarily a poor lifestyle choice. Someone who gets gout, not from eating, he's got a good eating habit, but he gets gout, arthritis, breaks an arm. How do those people get medical care? I don't have a problem. If South Carolina could get a waiver from the Affordable Care Act and not have to do anything, fine, as long as we address the problem. Access and affordability for everyone to get medical help. Fix people in the future. Start now. Start today. Eating properly, exercising, sleeping. But I still have to have the medications. I still need to go to the doctor to find out that I may have just a tiny bit of cancer and they can do surgery and get it out and I'm fine. But if I have no access to affordable health care, I won't see that I need the tumor. I might feel bad. I might feel run down. But I can't afford to go to the doctor, so that when I finally have to go to the doctor, I'm rushed to the hospital. The tumor has spread so much that they can't help. Or how about the woman whose heart was messed up and she had to go to the hospital because the prescription for her blood pressure had raised her potassium to an unhealthy level? It wasn't anything she did. You need to talk to the representatives and senators in South Carolina and say, yes, we want to have more healthy South Carolinians. We know good lifestyle choices will reduce healthcare costs. But what do we do in the meantime? How do we take care of the folks who can't get insurance because they can't afford it? How do they get health care? Because I'm going to tell you, the free clinics are not going to be able to care for everybody. So challenge the governor, challenge the GOP, challenge anybody in Columbia to give you an answer about how we're going to fix this situation that covers all the bases. All right. This has been Another Voice with Eric and Friends. You can find us on canIGetAWordIn.com. You can go to iTunes, go to Another Voice with Jason and Eric. You can go to Facebook at Another Voice with Jason and Eric. When you're out and about in the Greenville area and you're getting hungry, Little Pigs at Hudson Corner is where you need to go. 2428 Hudson Road in Greer. Great barbecue, folks. It's some of the best in town. Sweet tea, I think it is the best in the upstate. Great sides at a reasonable price. And if you've got a catering or a family event you need, business event you need catered, call Doug, 244-1090. He's going to give you a great price, work with your budget. That is Little Pigs at Hudson Corner. All right, we'll talk to you again next week.